We are getting questions from you about testing for COVID-19, and we're working to get those answers for you. Katie Johnston reached out to North Texas counties and doctors earlier today, and here's what you need to know if you are showing any kind of symptoms.
A lot of you are reaching out to us, desperate for answers about where you can go to get tested. Well, according to national officials, if you aren't showing any of the signs or symptoms of COVID-19, there's really no need to go get tested. Now, if you are showing all of those symptoms and you want to, you're going to go through several steps before you can get your official diagnosis. One thing for sure, the Texas Department of Health and Human Services is leaving it up to your doctor to decide whether you should be tested. Any county health department website says the same. Some ask you to call your doctor before showing up to a clinic. A lot of North Texas providers now have testing questionnaires online, like this one from Baylor Scott and White. There you'll be told either you need to come in for screening or you don't meet the criteria. I spoke with an infectious disease expert with Texas Health Resources who tells me when it comes to testing, doctors are prioritizing who gets those tests because there are people in our community who are more at risk.
It's very important that the folks who are over the age of 65 with the multiple health illnesses, they definitely take priority. You know, I've heard many scenarios where somebody has told me that, you know, this person I was sitting next to just came back from South Korea. I think I need to get tested. There's no need for that.
We are hearing from a lot of doctors who tell us if you are experiencing some of those symptoms, but they're more mild and you can treat at home and self-isolate, do so at least until some of these drive-through test sites are more readily available. And that way you're not exposing other people in your community who may be at a higher risk. Now, according to the CDC, if you are showing any signs or symptoms of COVID-19 or you've been in close contact with anybody who has been diagnosed with it, you should go ahead and contact your primary care physician. In Fort Worth, Katie Johnston for CBS 11 News.
All right, Katie, thank you very much.